Welcome back to Teeth Talk with the Dental Pro. I'm Dr. Kurt Kaser.
And I'm Dr. Carolyn Kaser, and this is Tiffany Benitez.
Hello.
She's one of our dental assistants that's been with us for about 18 years. And today we're going to talk about when to tell or how to tell when your child needs braces. So Kurt, when do you like to see these kids? When do they come into the office?
Yeah, so initially we want to see kids as early as 7, right? So we talk about 7 and up, where we want to see them for an initial consultation. In our practice, we typically treat only about 5 to 10% of those patients where we're actually going to need to do treatment, and it's for about 3 or 4 more kind of severe things that we're looking for. So most patients are going to come in, we want to see them, we want to take an x-ray, and we want to do an exam so we can check on the growth and development and how things are happening. There's a lot of things that we can catch at that age that doesn't necessarily mean we need to start treatment at that time frame, but that we know now what's happening and we can plan it out with the dentistry side, watch the growth and development over the next few years, and monitor that part, which can lead to much better results later on in life. There are about 3 or 4 things though at the same time that we want to start treatment and we want to identify those issues early, so when we see them at 7, that's actually the right time to treat. And a lot of times it's really hard to treat later. So when we see them at that age, we can correct a lot of severe problems that make a huge difference in the lives of the kids.
So just knowing from our personal experience, our daughter had an impacted canine. It was, the canine is the, third one over. It's the eye tooth that we call. It's the cornerstone of the mouth. It's a super important tooth. And a lot of times for me as a surgeon, I'm doing these what's called exposure and brackets, where if they're impacted and they're high up and they're kind of crooked, I'm putting a bracket on it and Kurt's bringing it down. And we tend to do this around 10, 11, 12, 13 years of age because it's more predictable. But with our daughter, we wanted to see if we could prevent that from happening. If you can avoid a surgery, fantastic. So what we ended up doing is, the tooth kind of heading this way. We took out a baby tooth. Kurt was able to put some brackets on the first 4 teeth in the back to kind of widen out the arch and to make some space, and that canine actually just dropped in. And that saves not only like an extra surgery, but it also, the tissue quality around the tooth is significantly better.
Yes.
Yeah, and how old was she when we put her braces on?
She was 7.5, 8.
Yeah, it was pretty early, so we call that, what do we call that? Phase 1?
Phase 1, yes.
Phase 1
in orthodontic terminology, it's called phase 1.
What are some other things you guys can think of that, besides the impacted canine or impacted tooth that we see diagnosing it early would help the child significantly?
Yeah, an underbite, right, where you have a lower jaw that's forward, right? That tells us that there's something with the growth and development. Sometimes it's actually just how the teeth have erupted in, and sometimes kids have baby teeth that don't fall out right away. And so what happens is the permanent teeth that are coming in come in behind, and then that changes the bite. The issue with that is when they start to shift forward into that bite, the longer that they're in that bite, the more that becomes the growth pattern, right? And so that leads to a sort of an increase in growth in that direction, which is what we want to not have happen, right? So it's not necessarily that the lower jaw is growing too much relative to the upper jaw, but because of how the teeth have come in, and those teeth are erupting in between 6 and 8 years old, which is why we want to see them at 7 to monitor that we can get the bite back to the position that we want, and then over the next 3, 4, 5 years of growth, we're in a much healthier position, and the underbite is not continuing on.
So I have another question for you. Tiffany, what was that patient? He was 12 years old. He had what he's talking about right now. He hasn't come to see us until now. He's 12 years old, and he's got what you're talking about. He's got this underbite, and the lower teeth were what? Where they were kind of coming?
Yeah, they were like very erupted over the top teeth.
Now, is it like game over for this kid? He's 12. Like what, he's got this, the underbite, just like you're talking about.
Right.
He's got some spacing issues. He's got a reverse curvus V, so he's got this, change in his occlusion. Yes. How are you gonna fix this kid?
Yes. So we need to see with him, like with the physical exam, of how severe is that, and this is where we take X-rays to see the skeletal part of it, right? Okay. Which we can't see, but those are or those are the diagnostic x-rays that we're taking and doing our measurements to determine, is this really the growth of the lower jaw relative to the upper jaw, or is this more of a tooth position issue, right? And everybody's a little bit different in that. Usually it's not that it's a growth of the lower jaw. That happens, but it's relatively uncommon to be that severe, right? But what you're talking about at 12 years old, we can still treat it, but it becomes more difficult. And there would have been 3 or 4 years of growth with the jaw in a forward position, which we could have prevented potentially at 7, 8, or 9 years old.
Yes,
right?
absolutely.
So it can still be done, but there's a lot of advantages to starting early.
Yeah, I absolutely agree. So a couple other things that I think about when I think about what we can prevent at 6, 7, 8 years of age. There's supernumeraries. I mean, Tiffany and I have done many surgeries where we remove an extra tooth that's kind of blocking the eruption of the adult tooth. And so what happens is, you try to wait, right? You want to see if the teeth come in, but the longer you wait, sometimes the teeth get off track. So like instead of coming perfectly straight down, you've got one coming in and one coming this way, and it's kind of stuck up top. And then Kurt has to get involved, right? Because he's got to put the bracket on. And he's got to bring it in. And so supernumeraries is something, retained baby teeth or ankylosed baby teeth. Tiffany, when you hear ankylosed baby teeth, what do you want to tell the folks out there?
Try to get in as soon, just because that tooth, if it is ankylosed, it's not going to move on its own. It's going to need help. And if there are baby teeth blocking those teeth, then they're not going to come in on their own. They're going to need the braces to make the room for them and help them come in.
And ankylosed teeth do not come out on their own. You have to surgically remove them. I really think too, when you think about an ankylosed tooth, like how would you know as a parent? The tooth's actually lower in occlusion. Like so the adult teeth come in, and then the other tooth is lower. So I'm trying to think of anything else. Can you think of anything else?
Yeah. So coming back to what you were saying earlier, I think one of the biggest things that we see is, and this is why we want to see them as those front teeth are coming in at 6, 7, 8 years of age. That one of the most common things that we see is an extra tooth that is blocking the eruption of a couple of the front teeth. And so we know that those front teeth should be in at 7 years old. We'll see people that come in at 10 that still don't have one of their front teeth in because there's an extra tooth blocking it. We would have picked that up at 7 years of age and been able to take out the extra tooth, which it needs to come out anyway, and then we're back on track with the normal eruption pattern. So that's a huge thing that we see, that it's super beneficial to catch at that age.
Yeah, absolutely. So, there's a lot of things that we can do to prevent eruption of adult teeth, or help eruption of adult teeth. There's a lot of things that we can prevent by doing, phase 1 treatment with ortho. The nice thing is it's free. You can come see Kurt. He's at all the offices. We have 3 locations, and it's free to see him and just get an opinion, because not every dentist understands growth and development. Not every dentist understands what an ankylosed, isn't really paying attention because they're so focused on their specialty and they're good at it, and this is what we're good at. So we would love to see your child 7, 8, 9. If not, it's not the end of the world. But we'd be happy to see them here at Dental Pros. All right, have a good day. Bye.